When I look around this room, I can't help but wonder, is Ozempic right for me?
Were advised by their doctors to take Ozempic to help with weight loss.
Battling the bulge is a fight too few of us win. And that's the reason drugs like Ozempic are so in demand.
And it's getting lots of attention for one of its side effects, weight loss.
The rise of weight loss drugs has sparked a weight loss craze, leading many to treat Ozempic, Wegovy, Zepbound, and Mounjaro as miracle cures to combat obesity. But what happens if these drugs don't live up to their hype? What if they fail to deliver the promised results? So, what exactly is Ozempic? Ozempic is an injectable medication approved by the FDA to treat type 2 diabetes and is often prescribed off-label for weight management. Ozempic has gained significant attention due to its weight loss potential, with users losing up to 7% of their body weight on a 1 milligram dose within a year. Follow-up studies indicate that weight loss continues up to 2 years after starting the medication. How does Ozempic help with weight loss? The active ingredient in Ozempic is semaglutide, a glucagon-like peptide-1 receptor agonist. GLP-1 receptor agonists are a class of medications that improve glycemic control in patients with type 2 diabetes and help manage obesity. GLP-1 is a hormone released from the gut after eating, increasing insulin secretion to lower blood sugar levels while decreasing glucagon, a hormone that raises blood sugar. This hormonal action helps regulate blood sugar levels. Moreover, GLP-1 slows gastric emptying, delaying the movement of food from the esophagus to the stomach. This effect increases satiety, reducing appetite, and subsequently leading to decreased food intake and weight reduction. How long does it take to lose weight on Ozempic? Clinical trials have shown that patients taking weekly doses of semaglutide can lose 5 to 10% of their body weight on average. In a 2022 study, overweight patients lost an average of 5.9% of their body weight after 3 months of weekly semaglutide injections. After 6 months of injections, the average weight loss was 10.9%. The time it takes for weight loss to occur while taking Ozempic varies from person to person. While many people may lose weight within the first 3 months, other factors, such as diet and exercise, can affect the rate of weight loss. Why aren't you losing weight on Ozempic? Despite its proven effectiveness in weight loss, some people don't lose as much weight as they expect on Ozempic. Why is that? Several factors could be influencing weight loss progress, from high stress levels to inadequate sleep or exercise. It might be necessary to adjust your diet, change the dosage with your healthcare provider, or simply give the drug more time to work. Here are some common reasons behind slower than expected weight loss on Ozempic. Be more patient. If you've just begun using Ozempic, that might explain why you haven't observed much weight loss yet. Patience is crucial when starting any new treatment plan, including Ozempic. To minimize side effects, healthcare providers start Ozempic at a low dose of 0.25 milligrams weekly. You'll remain at this dosage for 4 weeks before increasing it to 0.5 milligrams weekly. Depending on your body's response, your provider may continue increasing your dosage every 4 weeks until you reach the maximum of 1 to 2 milligrams weekly. Be patient and trust that the medication is working, even if you're not yet at the final dosage. Higher dosage of Ozempic. Gastrointestinal side effects like nausea and diarrhea are dose-dependent with Ozempic. Higher doses are more likely to cause these side effects, especially at the start of treatment, but they typically subside over time as your body adjusts. Everyone reacts differently to medication, and your weight loss on Ozempic may differ from others. Another consideration is that Ozempic is an off-label treatment for weight management, while the same active ingredient, semaglutide, is marketed under the brand name Wegovy specifically for weight loss. Although both contain the same ingredient, Wegovy has a higher maximum dose of 2.4 milligrams compared to Ozempic's 2 milligrams, which can significantly impact weight loss effectiveness. Make changes to your diet. Ozempic is intended to be taken in combination with lifestyle changes like a reduced calorie diet and increased physical activity. In clinical studies involving Ozempic, people taking a placebo received professional guidance on lifestyle changes, which explains why they also lost some weight, though less than those on the active medication. Aside from reducing overall caloric intake, other dietary habits could be hindering your weight loss efforts. Foods such as starches, refined carbohydrates, sugar-sweetened beverages, and red meat are all linked to weight gain. If you consume alcohol, that might also impede your progress. Eat more protein and fiber. Certain foods can speed up weight loss while taking Ozempic. Protein and fiber increase feelings of fullness, so eating foods rich in these macronutrients helps you feel full sooner, reducing food intake and promoting weight loss. The average adult should consume about 10 to 35% of daily calories from protein. When trying to lose weight, aim for the higher end of that range. Good sources of protein include meat, fish, poultry, milk, eggs, soy, tofu and tempeh, beans, lentils, legumes, nuts and nut butters, and quinoa. Experts recommend 25 grams of fiber daily for women and 38 grams for men. For For individuals over 50, these numbers drop slightly to 21 grams daily for women and 30 grams for men. Fiber-rich foods include fruits, vegetables, beans, legumes, nuts, seeds, and whole grains like oats and barley. Increase your physical activity. As mentioned earlier, Ozempic should be combined with a reduced calorie diet and increased physical activity. Healthcare professionals may recommend starting with 150 minutes of exercise per week, such as walking. While exercise alone has limited ability to promote significant weight loss, it does contribute and is essential for maintaining weight loss. Individuals who exercise more tend to lose more weight, especially when following a lower calorie diet. Exercise also accelerates metabolism, particularly when combining aerobic and resistance training. These exercises help build muscle mass while shedding fat. Don't stress it out. If your weight loss on Ozempic isn't meeting your expectations, stress could be a factor. Chronic stress from work or personal issues, as well as specific stressful events like losing a loved one, can lead to weight gain. Additionally, obesity itself can be a stressor due to social stigma. The more stressors you're facing, the more weight you might gain. Stress can contribute to weight gain in several ways. First, you may lack time to prepare healthy meals. Stressed individuals often exercise less and crave sugary, calorie-dense foods that slow down weight loss efforts. As a result, you may work out less frequently while consuming more calories than you burn. Stress can even affect hormone levels and parts of the brain and gut that influence hunger and food cravings. Get adequate sleep. Your sleep habits may also explain why you're not losing weight on Ozempic. Poor sleep habits, whether you're sleeping too much or too little, are linked to weight gain. People who get fewer than 6 hours or more than 8 hours of sleep are more likely to gain weight in the long run. Those who sleep too little experience hormonal changes that affect their hunger perception and increase cravings for high-calorie, refined carbohydrate foods. On the other hand, sleeping too much, over 10 hours daily, is linked to obesity and other weight-related conditions like diabetes and hypertension. Try a different treatment. Ozempic might be making headlines, but it's not the only medication available for weight loss, and not necessarily the most effective. Wegovy and Zepbound, for instance, they're a weekly injectable medication approved by the FDA for weight loss in individuals with obesity or those who are overweight with weight-related conditions like high blood pressure or heart disease. By now, it's evident that Ozempic isn't a magical or one-size-fits-all solution to the chronic problem of obesity. So how can you make Ozempic more effective? Taking Ozempic is just one of many positive steps toward a healthier lifestyle. Follow these healthy habits to maximize its effectiveness. Number 1, change what you eat and how you eat. The key to losing weight, whether you're taking Ozempic or not, is to consume fewer calories than you burn. Begin by reducing your caloric intake by 500 calories daily, aiming for fewer than 1,500 calories per day if possible, or as recommended by your healthcare provider. Consider following a Mediterranean or vegetarian diet, both proven to aid weight loss and improve blood sugar control. Limit or avoid salty, sugary, and fatty foods, as well as red meat and processed foods. Instead, focus on eating more vegetables, fruits, nuts, and whole grains. When it comes to snacking, try to limit late-night snacking and eating too late at night, both of which can lead to weight gain and disrupt your sleep cycle. Eat smaller portions and slow down while eating, focusing on savoring your food. Even small changes, such as choosing healthier snacks or eliminating one type of food or alcohol, can make a difference in weight loss. Number 2, move more. While people starting Ozempic may aim for 150 minutes of exercise per week, increasing this to 200 minutes can lead to better weight loss and maintenance. Health experts suggest at least 200 minutes of physical activity weekly to prevent weight gain and sustain weight loss while on Ozempic. Establishing a routine will help sustain the habit and make regular exercise a part of your lifestyle. Put it on your calendar and listen to music or a podcast to make it more enjoyable. Avoiding a sedentary lifestyle is crucial, so try to move more throughout the day. For instance, get up every hour and walk around your house or office for a few minutes. Number 3, choose healthy habits. In addition to diet and exercise, explore other healthy habits to support your weight loss journey with Ozempic. Avoid smoking and drinking. Find stress management techniques that work for you, such as yoga, deep breathing exercises, meditation, or a mix of these. Aim to get 7 to 8 hours of sleep per night. Staying hydrated is essential too. Drinking water can alleviate some of the less desirable side effects of Ozempic, such as nausea, vomiting, or diarrhea, while also aiding weight loss. Another healthy habit is seeking support from family and friends. Research indicates that finding support from friends, family, and co-workers who endorse your new diet and exercise goals makes you more likely to lose weight on Ozempic. Conversely, spending time with family members who don't practice healthy habits or criticize you for doing so can hinder your progress and lead to weight gain. Number 4, talk to your healthcare provider. Finally, consult your healthcare provider and ask why you're not losing weight on Ozempic. There might be weight loss strategies better suited to your body and health situation. They may also also recommend switching to alternative medications like Wegovy or Mounjaro, both known to aid weight loss. Don't lose hope if you're not losing as much weight as expected on Ozempic. Try implementing some of the above strategies and see if they help. In the meantime, enjoy the journey, be patient, and speak with a health professional for additional guidance. If you want to see more health, nutrition, and lifestyle tips, please subscribe to my channel and turn on notifications with the bell icon. Stay healthy and happy.